welcome to Roots Connections on Q for today, August. I'm a month ahead. August 25th, 2021. I hope that you're having a great week, that your week is off to a fantastic start. And we are going to have a very interactive program here this evening as we have our COVID-19 survivors share their own experiences with COVID-19. So whether you're listening to us via the radio, via Q95DA.com, or you're watching us on YSQFM or Push Past 10 on Facebook, I want to wish you a special good evening and welcome to the program. So come on in. Don't forget to share the live. Don't forget to let everyone know that we are here. We look forward to interacting with you and engaging with you, and maybe even hearing your own personal experiences with COVID-19, because I know we're all so tired of listening to to hearing about COVID-19 at this point. But unfortunately, we have to keep talking until we completely eradicate this disease and we can get back to our lives and we can get back to opening the Dominica economy. So again, welcome to the program. A special thank you, of course, to Mr. G and the Q95 family, Lambie and Showin in Dominica, Lambie who's at the console, and Showin, our engineer, for all the work that they do. So come on in, share the live, let us know where you're joining us from, and we look forward to our interaction with you today. So by way of introduction, we will go over to Dr. Yvette Rolle, and she will start by letting us know where in Dominica she is from, as well as anyone who has made a contribution to her upbringing as we celebrate our Dominican heritage. So Dr. Rolle, over to you.
First of all, I would like to thank you, Simone, for inviting me to be part of this forum. First of all, I must say thank you, God, because I feel very blessed to have survived COVID. And I also feel very privileged to be invited to Roots Connection on Q. And I must say that my values and my upbringing was influenced by my parents, and their faith was deeply rooted in the Catholic Christian faith. And I also had the occasion to be taught and mentored by my teachers. A lot of my teachers were very, very interactive with me and encouraged me and guided me forward. So the person that I am today is a result of the hard work of my teachers and my parents.
Thank you for sharing that. Unfortunately, we're having some technical difficulties with Roy, so we will continue to work with him. He is on the Facebook Live, he is on the program, but we're having some technical difficulties with his mic, so we will continue to work with him to see how he can join this very important conversation that we're having here this evening. And I thought it was especially important for us to have this conversation because as we can see, the number of cases of COVID-19, the number keeps rising. So from last year, we went from just, 3, 4 at a time, and now we're seeing 500 and 400, and it is very concerning. So I think part of what we try to do here at Q95 is provide our audience with the information that they need to make decisions. And I was particularly perplexed when I saw images from the COVID-19 quarantine centers of people twerking on beds, like we would say in Dominica, whining. We saw people consuming alcohol in the COVID center. We saw it like almost a party atmosphere. So, it gives the impression that COVID-19 is something that is not to be taken seriously, that even if you contract this deadly disease, that it is okay. And I just thought maybe the best way to convey the message of this disease is to have our guests come on and share. So we will talk about how you caught COVID, initially your symptoms, the effects, the disease process that you went through, Dr. Roll, as well as the long-term effects of COVID-19, what we call the long haulers. And we will continue to work to make sure that Roy can join the conversation. So I'm going to work with him in the background on those technical difficulties. And don't forget, you can call in to Q95 about 8 p.m., 9 p.m. This evening if you would like to join the conversation, as well as posting your comments and your feedback via Facebook Live. So, Dr. Roll, just kind of tell us how you caught COVID, the initial symptoms, and just kind of walk us through what you experienced initially.
Okay. I work as a nurse educator at the St. Thomas University in Houston, Texas. And I was facilitating labs for nursing students. And I remember that day that I worked in the lab, I kind of felt an itchy, scratchy throat, nostrils, and we do enforce masking, but sometimes the students don't wear them very well, or they don't put them snug enough. And we had a few students that we had to correct in mask wearing. I remember that distinctly. 3 days later, I received an email telling me that 3 of those students had tested positive for COVID-19 and that everyone in the lab was to observe for symptoms and also get a COVID test just to be sure. Well, 1 day later, after receiving that email, I started having sore throat, really severe sore throat. I'd never had that type of severe sore throat. I felt my throat was actually almost locked. And then I started having chills and fever and joint pains and muscle pains, severe headache. And I'm like, couldn't get out of bed. And I'm looking at my husband. I'm saying, I think I got it. And we had a testing site at our church. We go to the Catholic Church in Houston. And my husband said, you know something, let's just go and take you to the church because they have free COVID testing. And so I went to the church and got my test. He tested also. And 2 days later, I got my results and I was positive. I knew I would be positive anyway because by that time, I'm feeling this tightness in my chest. I'm feeling this overwhelming backache. I feel like I was getting a stroke. My head was pounding. And that night, I had to go to the emergency room because I felt my chest was so tight and the headache was so severe. And so I was taken to the emergency room and I was examined and I was diagnosed with COVID pneumonia. And right away, because of my age, I'm in that age range where you have to be careful. And they decided to go ahead and do an EKG. That was normal. I stayed in the emergency room for 8 hours because they were concerned about my chest tightness and the fact that I had COVID. So they went ahead and kept me monitoring my oxygen levels. Thank God they stayed stable. And finally, after 8 hours, I was discharged with some instructions. And here was the instructions I was discharged with. The nurse said to me, you know you have COVID, right? So you know you have to be quarantined for 2 weeks. I said, okay, I know that. And then she said to me, well, your oxygen saturation is okay. So this is what you will do. You're going to take some Tylenol for the pain and for the headache and for the fever. Take Tylenol every 4 to 6 hours. And in case you start having problems with breathing, just come back to the emergency room. Meanwhile, I'm going to give you a prescription for albuterol inhaler. And that was it. I was discharged home. That's when things really started getting severe when during my time at home, during that 2 weeks quarantine. My care provider was my husband, who happened to be working part-time at this point. And this is what I did. I took Tylenol every 4 to 6 hours. But guys, my most important medication during that time was ginger tea. And have you ever heard of ginger steam? Never heard of ginger steam, but my husband made some ginger tea, and while it was really boiling hot, he said, put your head over that cup and inhale that steam. And so I inhaled that steam. I did not have any appetite, so he had to really coax me and get creative in giving me fresh citrus fruit juices or fresh citrus wedges. I went ahead and did that. Then there was a minty, and then there was a celery, onion, garlic soups that he basically fed me with. And that was my experience with COVID. The headache responded to the Tylenol, the aches and pains a little bit to the Tylenol. But by week 2, I started feeling much better. I did not take the albuterol inhaler. I guess I shouldn't say that because I'm a nurse. I should know better. But I will tell you the ginger steam really did help clear my airway passages. And I never had to go back to the emergency room, and I am alive today. But when I think and I reflect on this whole experience, I say to myself, I have been out of work for 2 weeks. I was very fortunate at my job. I had this type of job where I got paid while I was sick. And I started thinking about those people who suffered from COVID and even went past 2 weeks and had to be hospitalized and put on ventilators. I thought about the economic situation. I thought about their jobs. I thought about how were they going to take care of their family and not have a job and not have money to put food on the table. And I thought that I was very blessed and very fortunate to have all of those so that I did not have to go through what some other people went through, like loss of jobs and also loss of life. And although my COVID did not go beyond what most people suffered, because quite a few people, I remember at the time I was looking at the numbers, 500,000 people dead in the United States of America from COVID. And that was in January. That's when I was struggling with that. And I'm like, Lord, I am so blessed. I survived, I survived. But think of these people who end up getting respiratory distress and respiratory arrest when the respiration stops, and they have to be placed on ventilators to help them to breathe, or they have to be placed on oxygen. I hear the stories of in places where there was not enough oxygen and people were literally dying in some third world countries because there was no oxygen available to support their breathing. And I thought to myself, as soon as I get out of this, I am going to get vaccinated because I do not want to have to go through this particular experience ever again. So within 2 months of having COVID, I went ahead and started vaccinating. And my family members, my immediate family members, my 2 sons, and my husband, and myself, we are all fully vaccinated. Am I
Yes,
taking too
thank you
much
for.
time?
No, absolutely
Oh,
not.
okay.
Absolutely not. The floor is yours. You can continue.
So with that said, with the vaccination, um, I know that there has been a lot of vaccine hesitancy. And I'm worried and concerned about vaccine hesitancy because I would like to remind ourselves, everybody, that vaccines are not new. They are not new drugs that have been used. Vaccines have been with us for quite some time. There is a polio vaccine. There's a hepatitis B vaccine. There is a yellow fever vaccine. There's a rubella vaccine. There's a polio vaccine. We do immunization. We give babies immunization um, within a few months after birth. And so I wondered why are people so hesitant? And then I heard things like, well, this vaccine just was manufactured overnight. And I'm like, what? Overnight? That vaccine manufacturing has been with us for a long time. So it could not have been basically manufactured overnight. The science is there, but what has changed is the technology. The technology has changed that very made it where we were able, or the scientists and the healthcare providers were able to manufacture these vaccines within a short space of time because of the technology enhancement, but the knowledge and the manufacturing of vaccine has been with us for ages. So I still do not understand why people are so hesitant. And there's something I would like to say, because as an educator, having taught students, I have also taught about vaccines. What is a vaccine? A vaccine is a drug that is manufactured using some of the molecules of the organism or the virus, and that is taken and given to a patient. That particular drug triggers off the creation of antibodies. And those antibodies can help the body, your body, to fight the infection. And so, antibodies being created by yourselves just from taking a drug that triggers that whole natural, normal process. That's what a vaccine does. And whenever there's times when there's epidemics, like the polio virus epidemic, vaccines are used to help our body to manufacture its own antibodies to help us to recover from the disease or to help to prevent us from getting the actual symptoms. So then we talk about, this is something else I've always heard people say also. Oh, but it's a drug and we don't know much about it. And I would like to remind each and every one of us that all drugs do have side effects. We have to weigh the benefit versus the gains, and also versus the adverse effects. And when taking that same way of thinking and bringing it to COVID vaccine, you have to say to yourself, do I want to take the COVID vaccine? And what is the benefit to me? And what are the disadvantages? So the benefit is that it will give you the capacity to help you to fight an infection. That's one plus about it. There may be side effects, like any other drug, there are side effects. But think of the benefit of not getting COVID and being able to fight it if you do get it, is that your economic gain, you will be able to continue to work so you don't rob your family of having some type of economic help. Then also you will be able to not take care of your family members. Like if you have young children, and you will also be able to prevent yourself from spreading the disease to family members and the friends.
Yes, and Dr. Roll, if I can just jump in here for a minute, because I think hopefully we've figured out the issue with Roy. Roy, can you hear me?
Yeah, I can hear you. Are you hearing me?
Excellent, excellent. So we can
Yes.
hear you. So thank you for being
Hi,
here. Thank
Yvette,
you.
what's up? What's up? What's
Thank,
up?
yes, thank you for
Is
your
that
patience. Thank you,
yeah.
thank you for
All
your
right.
patience while we figured it out. So just in like 5 minutes, introduce yourself and tell us where in Dominica you're from.
Okay. Actually, I was born in Roseau, but I was raised up in Newtown. What the thing is, I was raised up in Roseau and Newtown. What happened was my mother died when I was 2. And you had this battle between the father's side and the mother's side. So I was raised up first by the mother's side, and then I went over to the father's side. And when my father left and he went to England when I was about probably 6 years, then the mother side made claim for me, and I went over to the mother side. And I stayed with the mother side until I went to St. Mary's Academy. And then I fell in love with a girl on the father's side at Newtown, and I went back to live at Newtown. I
Excellent.
was
So
brought up by
just
both families.
in
I
the
was,
interest of
but I was
time,
born in Roseau, but brought up by both families.
right? So in the interest of time, just kind of tell us how you caught COVID and your initial symptoms.
First of all, I want to agree with Yvette concerning the side effect thing. I just want to say so. Presently, I have a clot in my right leg, and they are feeding me on Eloquist, right? But every time I take the Eloquist, I am giddy. I'm like a person who drank a whole bottle of rum. But I have to take it in order to, that the clot does not move. So here it is. I have all kind of problems for at least 4 or 5 hours after I've taken the Eloquist. But in order to that the clot will not move, what do? I have to take it. So all drugs, and I've taken probably 5 or 6 different drugs in one day, or I'm taking 5 or 6 different drugs in one day, and every one of them tells you there's a side effect. All right. As regards to COVID, I left. I'd been living in Miami for almost 40 years, and I went to Wakeland. Wakeland is a little town just around Tampa, between Fort Lauderdale and Tampa, and I went there. It was a social meeting, and I decided I was going to stay there because I was kind of fed up with being in Miami after 40 years. So when I was in Wakeland, I could not drive, so I had somebody driving me to all different areas. I wanted to go to supermarkets, etc. So I was brought to a supermarket, and I had my mask on, but I suspected that I had not used the hand cleaning material. I suspect I had not used that, but I still didn't worry about it until about probably 4 or 5 days later. I felt ill, and I still didn't connect it to COVID. I just thought it was the usual change of area, environment, and everything. And I started feeling very, very cold. And I had this big, heavy robe on me. And then I called my friend and I said, no, something is wrong. Something is wrong. I was feeling real cold. And she said, well, why not come over to my place and I will treat you? So I said, no, I need to go to the hospital and see what is wrong. And I went to the hospital and they told me that I had gotten the COVID, and I almost fainted. But however, I said, well, all right. She told me, well, I would have to start a place because they didn't keep me at the hospital. And maybe that was a mistake not to have kept me at the hospital. What they did was they sent me home to quarantine. And after about 3 days, I got worse. What was happening was, this it was a Dominican, and we believe in these herbs. And she was feeding me on herbs and tell me to go take sunlight and all those kind of things. And after about 4 days, I was feeling very, very sick. And I called my doctor and I said, listen, no, sorry. I called my daughter and I told her, I'm not feeling too well. And they had said that I had COVID. And I'm being fed there on herbs. And immediately, and maybe that is what saved my life. She did not say, well, let us see what's going to happen for another 4 or 5 days. Immediately, she called emergency. They came and they picked me up as soon as, now, the impression I got was I was just going to, be checked out. So I didn't bring clothes or bring anything with me. And then I was brought and put into ICU. And I'm wondering, well, what the hell is going on here? Am I that sick? And in ICU, they started working on me. I had tubes all over me, oxygen 24 hours. I was put on steroids. I was put on asthma tablets, and then I seem to have got over it, and they moved me to the other area, general area, and from there seem to have gone from bad to worse. So they still kept me on the steroids, and they still kept me on the asthma tablets. I couldn't sleep, so I had to be on sleeping tablets, and then I was diabetic. So here comes I'm being treated by 2 sets of medical personnel. One dealing with COVID and the other one dealing with my diabetes. So here it is, I have to take my insulin, I have to take my pressure tablets, and then when the doctors saw me about 4 or 5 days after, they said something is terribly wrong because my oxygen level was at 78. Now, I'd never heard anything about oxygen level being, I never knew anything about oxygen level. So I'm asking the doctor, what are you talking about? He said, your oxygen level is at 78, and we have to get it to at least 88, 90, and if we don't get it there, we have problems. So I started getting a little scared. So they fitted me with a lot of oxygen, and in 4 days, it went up to 79, and I could see something was not right with the doctors. So they said the best thing to do, let us remove this tiny hose, and they gave me a bigger tube, and my God, this thing was like you open a pipe, full blast, and this oxygen was going through my body and echoing, and I could not sleep, and I started screaming and screaming and screaming, take this off, take this off. And then the doctor said, if we take it off, you have a problem because we are now moving to 88, we cannot move it out because you are at 78 for so long, so let us stay at 88. And then I told him, regardless, I cannot sleep. I was like hitting a big drum in my ears. And then the doctor said, well, okay, let us take him to MRI to see maybe something wrong. So I said, well, you can see.
But Roy, before you continue, let me jump in real quick because we have the benefit of having a medical expert with us, Dr. Yvette Rolle, and I saw your reaction when Roy said his oxygen level was at 78. So in layman terms, what does that mean, Dr. Rolle?
It means that his body tissue is not being perfused with sufficient oxygen to maintain his physiological function. Just to be clear, the normal O2 saturation, we call it, the normal O2 saturation should be between 90 and 100%. So if he's 78 and he should be at 90, so you see how low he was.
Mm-hmm.
And I'm surprised they did not put you on a ventilator or something of that nature.
Right, right. They did not put me on a ventilator. So what they did was to increase the amount of oxygen they would put into my body. So what they did, they got a bigger hose. Normally, you have this thin nose, but it took a bigger hose.
Yes.
And that is what I said earlier on, that is speed in which the oxygen was getting into my body was causing this big noise, like a beating of a drum. And I was screaming at night. And that is why they said they brought me, then they brought me to MRI. They took it out, they brought me to MRI and had an MRI of my brains or my whatever, the top part of my whatever they were looking for. So I got a little nervous. I said, I don't think these people believe because I'm screaming, I'm getting crazy. It's all that the noise that was coming from my ears.
Yeah.
So they came back and they said they didn't find anything in my brain. So they brought me back, but they took off the hose and I got a little better. When I say in terms of the noise, a little better. And then now we have the problem where they put me on this machine and the machine now is showing me what my blood sugar, my oxygen level is going. And then I started seeing it started moving to 90.
Okay.
So I felt a little. You want to make a statement there?
No, I was just saying that was great.
Yeah.
You reached the
Yeah,
90.
but again, I run into more problems. I was so scared that on that machine, Doc, you probably have the medical name for it. You know, these bleepers that goes up and down with your heart.
Yeah.
Click, 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 click. And then, well, it's a joke to me now. But at some time, because of all the wires I had on me, I was moving and twisting and the wire came out. And when the wire came out, the sound leveled. Now, I've seen that in movies. As soon as that levels, you see doctors running all over the place and pumping people's heart. I say, oh God, this time, I used to call myself Bogey. I said, this time Bogey gone. Now, not realizing, had it been serious, I I wouldn't have time to even think, I'll be dead. But hearing that beeping song, I didn't see any doctor running there, so that told me there was something else. Just I found out that one of the wires came out. So it prevented, it prevented that. So they fed me on all these different things. And the doctor came up to me and he said, he didn't tell me in a term to get me scared, but he told me we have to use plasma on you. And when he said that, no, I'd heard people saying they don't, maybe you can explain to people what plasma is. I'd heard people saying in the Miami area that that was their last resort to use plasma. So he said he needed me to send some documents. At first I was skeptical, but I said, you know what, for what? You know, if it is something to save me, go right ahead. So I signed the document. So I don't know if before I go further, you can explain to Dominicans what is plasma, because I did not know. All I was told is that they could not go any further, and they didn't put me on a ventilator, and they were giving me all these different types of tablets, and they now said, we're going to put you on plasma. So maybe you can, Doc, explain what that is.
Yes, that would be a great idea.
Yeah, what I would like to say is that because COVID, they don't have set regimens on how to treat COVID. So they try a lot of things, and plasma is the liquid part of the blood. So instead of giving you blood transfusion, which is red, that has red blood cells, they gave you the liquid part of the blood. And so what they have been trying is to give people plasma to see whether that helps to boost their immune system. Something else that they also use is monoclonal antibodies. I'm not sure if you get a chance to get that also. Monoclonal antibodies are actually actual antibodies that are actually placed and infused intravenously into the patient. And that is the latest thing that they have right now. And it's people are taking it and yet still refusing the vaccine, and the vaccine helps them to manufacture their own antibodies. But as far as the plasma, I'm not for sure what exactly why you got the plasma. All
No,
I
they
can
did
say
not.
is,
They did not give it to me.
oh, they did not give, you were
I should have. I
considering
should
it.
have. Yeah, they did not give it to me. What happened is they gave me to sign some documents authorizing them to give me the plasma. I signed the document, and like a miracle, next day the doctor said to hold on. My body is fighting
It's fighting
the
disease one.
COVID, so they stopped there. And
Yeah, and let me just jump in real quick, because I think the other thing we have to keep in mind as well is two of the organs that COVID-19 especially attacks is your heart and your lungs. So Doc, if you can talk to us on that, the implications for our hearts and lungs in this fight with COVID-19.
Okay, for example, COVID affects your lungs, your kidneys too, by the way. There are people who have kidney disease secondary to COVID infection. There are people who have developed cardiac failure secondary to COVID infection.
And
And
why is that? Why is that? Do you know?
because the virus itself attacks your organ systems. It attacks your organ systems, and for some reason, it attacks your heart, it attacks your kidneys, it attacks your GI system, your gastrointestinal system. That's why some people have diarrhea and some people have vomiting. It's the virus, it's the effects of the virus and the toxins it releases that basically affects every body system within a person who's infected, some more than others. So I like the fact that you brought myself and Roy, because I did not get as many effects of COVID as Roy did, and he still has residual effects. Now, this is what happened. When you have the virus can cause what is called inflammation of the heart, endocarditis, pericarditis, all these itis is inflammation, infection of the heart muscle. Now, when the heart is inflamed and infected, it does not work as well as it should. And if it's not really controlled, eventually the heart is not able to pump sufficiently and the person can go into heart failure. If you have COVID pneumonia and that COVID pneumonia compromises your oxygen saturation levels, like he had very low oxygen level saturation. Eventually, if he was not able to get his lungs to start working again, he will have what is called respiratory arrest. The heart and the lung work together for the body to function. One depends on the other. So if you have respiratory failure, the next thing that's going to happen is cardiac failure and cardiac arrest. And
Yeah,
these two
absolutely.
organ systems, yes, these two
Yeah,
organ
and thank you
systems.
for sharing that. And I think that is why I agree with Dr. Carissa Etienne from PAHO, who says that we're playing with our lives because we see all the different strains, we see all the different variants, the Delta variant, which we don't, as a fact, know if it's currently in Dominica, but it is certainly more contagious and more deadly. And we also have to remember we went from being asymptomatic in Dominica to now people actually getting sick from COVID-19. We have people with underlying conditions such as diabetes, which Roy talked about, and we simply do not know how our bodies are going to respond to COVID-19. So I think that, and we'll talk about this towards the end of the program, that we absolutely have to engage a toolkit, different approaches,
Yes,
because it almost seems like when people talk about the cure for COVID-19, we're either talking about boosting your immune system or taking the
yes.
vaccine. It
Very good.
always sounds like it's one or the other. Why can't it be both? So, towards the end of the program, I want us to talk about a toolkit that we can engage in the fight for this deadly virus. But before we do, I also wanted us to talk about the fact that you weren't able to take care of yourself. And I think of the single moms out there. I
Yeah.
think of the single dads. I think of the grandmothers out there, the uncles, the aunts, whoever is responsible for taking care of someone else. I think about them and I wonder what would happen if you contracted COVID. So just kind of tell us your experience in terms of how debilitating the virus was with you. And Doc, we'll start with you.
Yeah, with me, I am telling you right now, if I did not have someone else in the house besides myself, which is my husband, I don't think I would have had a very good outcome because I had no energy. I had no interest in food. There's something else COVID does is that it makes you sleep, and sometimes you're not able to wake yourself up. These are
Hmm.
some other things that, yes, my husband used to have to wake me up, and the first week I was not myself. I'm not sure who I was. I couldn't figure out what was going on. All I remember is being woken up and saying, "Wake up, wake up, wake up." Um, so think of me being alone in this house and not having someone who can care for me. And that's something else that I think even in the United States, healthcare providers, they don't really ask you about, at least they did not ask me, about who would be able to take care of you at home. And maybe because I was a nurse and they knew, maybe that's why they never asked me anything. But you need someone to care for you. You need someone to make sure food is available. You need someone to make sure that you can eat the food, because something that you do not feel for food, there is no feeling to eat. And think of that, not drinking fluid, that's something else that kills people too. The high fever can cause severe dehydration, so that's
Mhm.
why they say take lots of fluids. And if you do not have sufficient fluids and become dehydrated, you can go into shock. And if you go into shock, guess what, your heart and your lungs can also stop working. So there are so many things that can happen as a side effect of, and I still say that if I was alone, I may have developed further side effects because I would not have had someone there to help me, someone here to feed me, to make sure I got all the soups to boost my immune system and all the vitamin C and the ginger and all the things that my husband did to try to get me to move forward. So with Roy, I'm thinking if Roy, with things the way they were with you, I'm wondering, did you have somebody else help you at home?
No, that's what. When after having heard what you said, I was fortunate to have been at the hospital
Yes.
because most of the things you said there, of things I am now thinking of that I went through. But at the time, I thought it had to do with something else, not COVID. For instance, I was diagnosed before I get to the diagnosis, a part of it. After as you said, I was very, very weak. I didn't have the power to go to the bathroom to do what we do what we do. You know that, yeah. I didn't have
Yeah.
the power. I could not do it. So it was 5 days I could not do it. And they were afraid to give me some kind of constipated tablets to do it. So that had to stay in my system. And then when I had to go to urinate, I could not get off the bed and go to the toilet. So I had to sit part of my feet on the ground, the other part of my backside very close to the edge of the bed. And what they did, they gave me a
Suppository?
plastic bottle, those plastic bottles from there. But fortunate for me, or I don't want to say it's fortunate for me, that it was coming down. The urine was coming down by itself, but I had no power to push it. So I just had, as soon as I felt the urge, I knew it was coming. So I would take the bottle, fit the bottle in it, and just wait there, and the urine did its own thing because I didn't have no power to push it. That didn't tell you how weak I was. And then when everything was over and I called the nurse, especially in the time when I used the toilet, I didn't have the power to bend to clean my own self. And at one time, I felt a little, I said embarrassed, but I felt a little funny in that I could not clean myself. And the person who had to clean me was a white nurse. You know how the mentality of the black and the white, and I'm saying to myself, do you think she will do a good job? So she said, first thing she said to me, Mr. Williams, all you have to do is do whatever I tell you and don't worry about anything. Apparently, she must have known in her mind this concept we have of black and white and black and white. So she did, it's like a disclaimer. I am here, I am white, don't worry about a thing, I'm going to take care of you. Although that is what she was trying to tell me, but in a different term. So what she did was to put me on the bed and open my both legs wide and my stomach on the bed and come from behind and clean me. And I felt a little funny because I've never had anybody done that to me, far less to have a white young nurse coming to do that. So after all these things were done, and I started feeling better, I could move from the bed to the chair. Then I had my first bath, and that was in probably 10 days.
Yeah.
And when I went to the bath, they brought me there and I took off my clothes. I'm feeling more embarrassed again because here is a big old man stand up there naked and you have these ladies there watching you and you feel a little funny because I'm not used to that. However, they put me to sit down and they opened the water and they came, and when I got out, I couldn't use the towel. And Doc, I never realized the amount of energy one uses to the bath towel to clean himself, or the amount of energy you use to fix your pillow and your sheets on your bed. I never realized that. I was so weak, I could not do that, especially when I went. Anyhow, to move on, then I suspected like they were, I would say they were using it, but they were not sure which would work. So they were using all different types of medication.
Yes.
For instance, like they using the steroids, they using asthmatic. They told me I had pneumonia. Then they came in with my insulin. And you know, I was taking all those things, and maybe I had a strong body. So when all this was done, about 2 weeks later, my daughter called me and asked me if I got the good news. So they came and they tested me. And my daughter called me and asked me if I got the good news. And I'm telling her, what kind of news? Is there something happening in Dominica? She said, no. You're now free of COVID. Doc,
Can I
I
ask you a
cried
question?
like a
How
child.
how many weeks
I
before you got
cried.
a negative test? How many weeks before you got a negative test? Roy.
No, well, when I went to the doctor 2 weeks
2
after
weeks.
I got the negative test, while I was in the hospital 2.5 weeks, when they fed me on all these different type of medication and oxygen 24 hours, and I was eating. There was one I heard it said people are not eating, but I was eating. I was eating a lot.
Mhm.
But
Really?
Mhm.
You had
Because
I
appetite? You never lost
everybody
appetite?
responds differently. Everybody responds
I see.
differently. But before you continue, Roy, before you continue, let me just jump in for a minute because I hear you talk about different medications, and our focus is really on our Dominican brothers and sisters in Dominica. And I'm just thinking to myself, with all the shutdowns of the country, no stimulus package, people out of work, I'm just wondering. I mean, you and Dr. Rolle had the benefits of being sick in America, and it is a benefit to be sick in America. Let's be honest, in America and Jamaica, for Roy, and you have the medicine
no,
of the
when I
benefits.
got the COVID, I was not in
He was in
Jamaica. I
Miami.
was
Oh,
in
Miami,
yeah, I was
that's
in
true.
Miami.
So
No,
right,
not
so
in
you had the
Miami,
benefit.
Wakeland. I was in Wakeland. I
Yeah,
was
so
in
you
Wakeland in the States. I was not in Jamaica.
yeah,
Okay.
so
Had I
you
been
had
in
the
any of, had I been in any of the Caribbean islands, I don't think I would have made it.
Don't say
right.
that.
So you had the benefit of the American system. So thank you for that correction.
Right,
But I'm just thinking
right.
about the people at home in Dominica who have to pay for medications. And here we don't have the jobs, we don't have a stimulus package, and people have to pay for medications. And I'm also concerned that we saw the recent death of Kathleen Sentil here, who was actually a classmate of mine, and we sent condolences to her family. And I'm just concerned about how quickly she deteriorated to the point that she wasn't even at the hospital when she died. She actually died in the COVID-19 center. And I know I'm looking at the Facebook Live and all the comments, and I promise we're coming to you at 9 p.m. But those are the concerns that come to mind, the debilitating effects of the disease to the point where you can't even take care of yourself, to much less take care of other people in your household, to the price of the medications. And here we are, the vaccines are free, and we will again talk about the toolkit that we're hoping everyone will sign on for personally to be able to combat COVID-19. So I just thought that I would throw that in as we're having this conversation. Any other thoughts you guys want to share before
I'm
we
going to
jump on the
yeah.
phone calls?
I'm going to go ahead and share something that happened in Lake
Just, just,
City.
just, just before the doc, just to tell what you just said there in terms of the medication, a Dominican would probably have difficulties in having all that medication because I'm talking about asthma tablets, I'm talking about steroids, I'm talking about Eloquest. These are top brand medication. Do we have that? And what happened again? Well, the doctor probably will know that. When I got in there, I came in with my own medication, my own insulin, they said, no, 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 you cannot, we're not going to use that. You put everything in a bag and you put that away. And they started with their own medication. Can we afford to do that?
No,
You
that
know what I'm saying? So it would have been very difficult for one having to go for
yeah.
all that kind of medication in a place like Dominica. Because immediately they said to me, I had my insulin with me, I had my Eloquist with me, I had my pressure tablets with me, I even had cholesterol tablets with me. And they said, I cannot use that. They put it aside and they bought me a new batch of everything they thought I needed. So it would have been very difficult for you to have come there, let's say in a place, I'm not trying to bring on Dominica, but I'm
No,
saying
it's
to have
not that.
come
It's
to a place like Dominica and for them to tell you, you cannot use it. We have that, but I don't believe they would have had that. So it would have been very difficult to survive under the circumstances. So I call myself very fortunate to have been in America and get that kind of treatment.
Yes, thank you.
with that said, Roy, because again, they did not know for sure how to actually treat COVID. They were treating your
Right.
symptoms of COVID. And that's why
Just
they were
one,
giving you all this
just there,
medication.
I'd like to know, I got it in October. All right, so that will give, yeah. So it was in the center of all the drama and all the
Right.
problems you have. So I got it in October. Yep.
Right. Go
So
ahead, Doc.
they try all that stuff because for me, I had COVID pneumonia. They gave me albuterol inhaler. Albuterol is also given to asthma patients for, to help their bronchioles, their lungs open up and they can breathe better. So that's the same thing, but they gave me the inhaler. They gave you the tablets. They were not sure. They figure out that if you have a pneumonia, you have inflammation. So they jump and they give you steroids because the steroid is supposed to cure and decrease inflammation. You see, so now they're adding another thing which is called monoclonal antibodies right now to treat people, and which I find is a joke because the antibodies you can make in your own body by taking the vaccine. So that's my little peeve there. So I just wanted to throw that out there. In Dominica, I know the Dominican health system does not have the kind of sophisticated drugs and the sophisticated procedures that are done in the United States. But I do still believe that we are able to supply patients with oxygen and maybe put them on a ventilator if they really need one, or if not, airlift them to Martinique, Guadeloupe. I'm not sure. But I'm just saying that because I have worked in Dominica. I did not always work in the United States. I worked as a registered nurse in Dominican Glover Ward and Alford Ward and maternity. And so I know we can give good care. I know that sometimes we get carried away with the brand name medications, but I do know that within the healthcare system in Dominica, I know there are good healthcare providers, and I know our heart is in the right place.
Yes, and thank you for that. And let's just remind everyone, if you joined us late, you're listening to Roots Connections on Q. I am Simone Mathieu, and our guests today are Mr. Roy Williams out there in Jamaica and Dr. Yvette Rolle, and they're sharing their stories as COVID-19 survivors. So we now invite your calls, and Lambi will give us the numbers so
Just
we
before,
can. Sure, go ahead, Roy.
Simon, um, before we go there, I just wanted to strengthen what doctor said about the effect it has on the lungs. Because after I just wanted to strengthen the effect she said it has on the lungs. I just wanted to bring that in before we go to the questioning. When I was discharged from the hospital, after I was tested twice, being negative, I was told I could go home or go to a rehabilitation center. And they said they recommended a rehabilitation center because they found that there was so much damage to my lungs. In fact, I understood that I was using 45% of my lung. So they sent me to a rehabilitation center, which I spent another 3 weeks to get back my strength. So when you said about forget it.
Yeah, the
Another
lungs.
thing you
Yeah.
said, another thing which you said, which is of concern to me right now, is when after I was released, from the rehabilitation center, I had difficulties in walking and all of that. That was expected because my lung was irritated. But I was rather surprised that when I went to my urologist for a test, and here it is, they were telling me even my kidneys was damaged.
Yes.
And I said, what's going on here? She said, yes, not only your lungs, but your kidneys are damaged. The only thing is, I did not know how much damage to my heart because I have not seen a cardiologist since I left. But I have, even at this stage, I still have difficulties in walking very fast. One last thing, if I was to walk up Mont Fidel, right, just casual walk, by the time I reach at the top of Mont Fidel, I'm gasping for air. That to tell you what
The damage
COVID
to
can
the
do
lungs.
for you.
Yes, thank you so much for sharing that, Roy. So, Lambi, we will come over to you so you can provide us with the phone numbers for anyone who would like to make a contribution.
The numbers are 449-3095, 449-3096, 449-3097, 616-4257, 305-432-9624. And we are taking your calls right now. There's someone on the line. Caller, please go ahead. Caller, are you there? Nothing?
Lambi, I forgot to recognize you. I'm sorry about that. You're so all masked up. I did not recognize you at first. So have a good night, my boy.
Okay, thanks. Caller, please go ahead.
Yes, good night.
Good
Thanks
evening.
for coming.
Good night.
I heard the first medical person say that she had good support, citrus, steam, vegetable soup at home. And she did not take the doctor medicine, and she recovered quickly. So and then her body maybe fight it and put out its own response. So maybe she had gone to the hospital, taken steroid and those things. That could have weakened her, and it would prolong the illness. Because it has been proven time and time again that if our body gets a little help, and sometimes with no help, if we are strong, we fight the illness, and the vaccine has a lot of unknown. And the most important one, they say the new variant, it doesn't work against it. And you could take the vaccine and still spread the disease. So we get in a complex state. So best we go like the First Lady. All now, before we get sick, strengthen our immune system and take the steam and the vegetable and the citrus. All the best. Take care.
Yes, and thank you for that comment. Thank you for calling in, caller. And you raised some valid points. And again, we will come back to them once we start talking about our toolkit for fighting COVID-19. Lambi, you have any other calls?
Another call on the line. Caller, please go ahead.
Good night, Lambi.
Good night.
Good evening.
You all keep on saying Yvette Rolle, but I know her and Yvette. I'm not too sure. That is Bob's daughter. She's my schoolmate, and she was Charles before Charles. So I wonder if it's that same Yvette.
Yes.
Like Roy, my old worker by NAPIP, as Pamela Sophie, Elizabeth, for Siki. So I would like to know, and I'm joining me what you are saying. I'm listening.
Thank you.
Good use of everything you are saying. But I just want to know if it's that Yvette Charles, and she's
Yes. Yeah, that's Yvette Charles, and Yvette Charles Rolle. Rolle is the husband's name. That's the same Yvette Charles used to live in Kennedy Avenue.
Yes, I know she remembers you from NASIP.
Yeah.
Okay. That's okay. Another call.
Yes. So thank you, Lambi, and we want to go over and take the comments from Facebook, and we want to thank everyone who's joining us. Lambi, you have a call?
Line. Caller, please go ahead.
Oh, yes. I forgot to ask whether the first COVID death was fully vaccinated.
Do we have that information?
That I'm not sure of.
We don't have that information.
We will pass it back to you, Simone.
Yes, thank you. Yes, that would be a very good question to find out from the health professionals. And if anyone on Facebook Live knows the answer to that question, we would certainly appreciate your feedback on that. So we want to say good evening and thank you for everyone who's joining us on Facebook Live. We see Carl Kofi is with us. We have Dr. Wilhelmine Adrian, and I have to say a special good evening and thank you to her because she was the one who referred Dr. Yvette Rolle to us. So Dr. Adrian, thank you for being here. Let's see, we have Beverly Johnson. Good evening, everyone listening from California. Thank you, Dr. Simone and guests, for such an informative program. Hi, Agnes. Tina Bell, always great to see you. My cousin, Malcolm Rodney in Guadeloupe. I would certainly appreciate it if you could give us an update because we know there's a lot going on in Guadeloupe right now that surrounds COVID-19. David Joseph says, a pleasant good evening to one and all. Looking forward to another great and educational experience. David, thank you for being here. Lauren Del Sol, good evening, Dr. Simone. We have Sandra Norris. I had COVID. Also, interesting, absolutely no symptoms. I had to quarantine for 2 weeks. And we're also going to get into, as we continue with our discussion, the home isolation protocols in Dominica. So we will talk about that in just a little while. Annette Phillip, good evening. Thank you for being here. Sabria Senhouse, thank you for being here as well. Let's see who else. David Joseph. My only concern about the vaccine is that a threat of mandatory vaccination. We know that vaccines work. However, some people are at risk from the vaccine itself. Some people will be asymptomatic, while others will be exposed to the virus over and over again and will not get the virus. Education about the vaccine alone, with the continued wearing of masks, physical distancing, and proper hygiene, is paramount to quelling this virus. So, Dr. Yvette, Dr. Rolle, in your professional experience, should the vaccine be mandated? Because we see when we were younger, so many of the vaccines were required to attend school. So, in your professional opinion, should the vaccine be mandatory?
Because I'm all about vaccine, because I've seen vaccine work, and historically, I like to say historically, we have utilized vaccine to quell pandemics. It is something that we have in our history as healthcare providers, and they have worked. And because I was a nurse midwife and I took care of moms and babies, and again, it was mandatory that babies up a certain number of months, can't remember exactly how much it used to be in Dominica, they had to have their polio and their MMR vaccines. And they had to have that within that time frame. It was mandatory. Now, it's all about public health. And if we're able to give babies the advantage of creating their own antibodies from vaccines, then we are able to prevent infections long term. And that's how we were able to get rid of polio. Because as you know, we no longer have polio. And polio infection, polio virus was a pandemic once upon a time. And so was rubella, So I I always say, I have some nieces who say that you have the right to take a vaccine or not have the right to take a vaccine. I'm looking at it from there. Yes, you have the right, but do you have the right to spread the infection? Do you have a right to get sick and all your family and not be able to be productive or care for family members? Do you have that right? What about caring for others as you care for yourself? So, from that point of view, I believe that vaccine should be mandated. That's just my point of view.
Yes.
And I don't
Yes.
expect anybody
Mhm.
to agree with that, but I'm talking professionally and from historical information about vaccines. Vaccines do work, and vaccines, like I said, do have side effects. They are drugs. They are drugs, and there is no drug, not even antihypertensive drugs, not even those drugs that we take to treat high blood pressure. They too have side effects. But we say, do we keep the blood pressure high, or do we run the risk of having a side effect but keep our blood pressures low so people don't get strokes?
Yes, thank
So
you for
that's
that,
my
Anat.
thinking. That's my thinking.
Yes, and let me take a few more comments on the Facebook Live. We have a very engaged audience, and we're thankful for that. We have Carl Kofi James, who said, I got COVID and I wish it not on others. Fortunately, my lifestyle prior to COVID may have played a big part in me overcoming and keeping this deadly COVID in check. It took me just about 2 weeks to feel normal again. Roy, you can chime in on that one. What would you say about the importance of being strong and just being able to have that immunity already built in terms of fighting COVID? And part of that is exercise. I know a lot of times we don't like the dreaded E word, but part of that is exercising and maintaining a strong body. Roy, you have any thoughts on that?
Yeah, well, the thing is, all my life I was involved in sports.
Yes.
And maybe that helped me in my later days. And I never stopped exercising. Even when I came to live in Miami, and even at the age of 70, I did my exercising. I went to the gym and I did the best I could. Maybe that helped me, and maybe that helped fight my immune system. But something is that we never realize how strong we are or how weak we are because we're so concerned with our daily ways of life. We're not considering those things. And maybe that helped me because even like I said, now I'm still having difficulties in breathing properly because COVID is nothing to play with. And it's not looking for one part of the body. It's looking for everywhere. But everybody seems to think that it's only a lung problem. It's not a lung problem. So I would encourage the younger people now, don't just go to the exercising room or just don't go to practice like we call it because you want to make a football team or cricket team or whatever team. You should do that as a way of life. Always go do your exercises at least 3-4 times a day, and you'll be surprised what that can do for you later down in your life. And I kept on saying, apart from the help of God, that I survived that. Maybe it had to do with the fact that I'd never just, even at my later age, just decided, well, I no longer needed exercises. I always did my exercise. And the doctors never said that is what helped me. They never told me exactly why my immune system was fighting just around the time I was supposed to have been given plasma. Maybe it was an act of God. I don't know. But all I'm saying is keep on doing your exercises, keep on eating right. And like the doctor said, I agree with her that it should be mandatory. And I say that because of what I went through and what I've seen people around me in the hospital was going through. You know what I'm saying? And it's not fair that because somebody has probably their political ideas and feels because it's the government, especially in the Caribbean islands, that are bringing it in, that we should not take it. I personally believe that it should be mandatory, and I personally believe everybody should take it because I'm saying that because of my experience. Maybe had I not gone through that experience, I could have a different idea of things. But having seen what I saw and having undergone that situation, when you, as a big man, you cannot wipe yourself. As a big man, you cannot bring a cup to your mouth to drink. As a big man, you think you're powerful, you're aged, everybody likes you. There's nobody to help you to fix your bed, put your beds on your sheet, and there's nobody to bring you to the bath to take a shower. When you go through all those things, it's important that you realize that things like exercises, good food, and medication subscribed by a doctor is the best way out. I personally agree with the doc that it should be mandatory, and I believe everybody in Dominica should be vaccinated.
Yes, I think we have a call coming in. Perfect timing. We can't hear you, Lambi.
Good evening. Go ahead, please.
I heard the doctor said something, and it triggered something. He said that, do I have the right to spread the disease among this one or that one or the other? My question, can the vaccine prevent me from getting the disease, and can the vaccine prevent me from spreading the disease? Please answer me truthfully. Thank you.
Okay.
Yes, doctor.
Like I said before, a vaccine usually helps your immune system to manufacture antibodies. Those antibodies help your body to fight the disease. And so if the antibodies are working in coordination with your immune system and is able to fight that particular virus, then you will not spread the virus and you will not have symptoms, severe symptoms of disease. Now, this is what's happening. We are seeing people who have been vaccinated very early in January. People who have been vaccinated are getting what is called breakthrough infections. But guess what? These people who get breakthrough infections, they survive. They are surviving. Some of them may get ill. Some of them may still, if anytime you get ill, you have the ability to spread the virus. So if you have a breakthrough infection, even though you've been vaccinated, you still have the ability to spread the virus. However, if you get sick, you have a higher risk. I mean, a higher, how would I say it? The opportunity to fight that disease and be cured and move on. But if you don't get vaccinated, you don't have that. Right now, I want to tell that story because I think it's very, very important. There was this couple in Leak City in close to Houston, Texas, where I live. And these two people, family of four, the mother and the father decided that they were not going to get vaccinated and they did not want their teenagers to become vaccinated. They were anti-vaxxers, they call them. Last 2 weeks, two of these people, the mother and the father, they got infected. They got infected with the Delta variant. They were never vaccinated. And they got so sick that they were crying, and they had them on the TV. One of them had oxygen, the other one could not speak because he was on a ventilator as a daddy. And they were begging their kids, children, get vaccinated. At least if you get vaccinated, you have a chance of beating this infection. Unfortunately, both of them died the following week. Both of them died the following week. So what we are seeing now is death among the unvaccinated. We are seeing breakthrough infections in the vaccinated population. But so far, based on my data up to when I checked, we had not had any cases where people died from secondary infection after being vaccinated. So that's what we are doing right now. We do not want to have more COVID deaths. We do not want to have more COVID deaths.
Yes, thank you for that. And let's just grab some of the comments on Facebook before we proceed. Annette Phillips says, yeah, the hospital does that with medications. I went through that when I was hospitalized. So I think she's referring to the fact that you could not bring your own medication in, like Roy talked about earlier. We have Roslyn. Good evening, Roslyn. Always great to have you on the Facebook Live. David Joseph says, my cousin did all the herbs and the steaming as a strong 58-year-old with no underlying conditions, yet he is no longer with us.
Yes.
So I guess that is the luck of the draw. Wow, David, thank you for sharing that. And I'm so glad everyone is sharing their own personal experience with COVID-19 because, again, we simply do not know how we will respond. And I just want to echo what Dr. Rolle said with regards to not getting as ill from the COVID-19 and being given the chance to fight the battle against this deadly virus by getting the vaccine. Owen Prosper, good evening, Patriots. I am locked. Owen, thank you for being here. Annette Phillip, Dr. Yvette, I agree 100%. The vaccine should be mandated. So I'm happy to see that we can agree and disagree and still be respectful. So thank you for that, everyone who's joining us on the Facebook Live. Let's see, we have Lorraine Del Sol. As soon as the COVID vaccine is approved for under 12-year-old, it is going to become mandatory to attend school. That's in Canada. So Lorraine is joining us from Canada, and I want to thank her for her contribution to our program this evening. Owen Prosper, I took my COVID vaccination a few months ago, and if the situation calls to take it again, I definitely will. Medina Senos, my mom, thank you for being here. Dr. Adrian, who's on the live, says, what people should understand too is that vaccinated people should continue to wash their hands and wear their mask to prevent reinfection of COVID. If they do not contract the virus, then they cannot spread it. So, I always like to think of this as a brand new war. We've never seen this before. The last time we had a pandemic of this magnitude was over 100 years ago, and none of us were here. So I like to think of this as a moving target. So as we learn more information, we apply more information, as things change, we have to be willing to change and move in order to be able to eradicate this disease. So any feedback on the comments that are coming in this evening, Roy?
Could you repeat that, please?
Yes, I was just asking you if you have any comments on the feedback that we're getting on the Facebook Live, and I want to thank everyone for their wonderful contribution as always.
Well, yeah, what I would like to say, I would like to thank, well, I did that already, but, in the interest of people probably not saying that I didn't give any thanks to to doctors and nurses. Personally, I want to thank all the nurses and the doctors, in particular, the nurses in Dominica, because I don't think we take them for granted. And I don't think a lot of us are aware what goes in there, especially now with this pandemic. What you have to do, or what has to be done, is probably the government should have one or two people in the hospital observing what the nurses have to go through, and then come back to the media and give their own the assessment of what they have seen. That could be good, because it's not easy, especially at this point in time, what the doctors and especially the nurses. So I want to thank all doctors and all nurses, and even the nurses in Dominica and the doctors in Dominica who probably didn't take care of me at the time.
Yes,
But I need to
Roy, I'm so
on their
sorry
behalf,
to,
all nurses
I'm
and
so
all
sorry.
doctors.
I'm so sorry to interrupt, but we have a call and we don't want to keep them holding. So let's just take the
Right,
call and we'll come right back. We'll come right back to you.
That's okay.
Good evening,
Yes.
good evening, caller. Go right ahead.
Yeah, good evening, panelists. Good evening,
Good evening.
gentlemen, ladies.
Evening.
What a wonderful program. And you know what I like
Thank
about
you.
this program? The integration of those who have had the experience of COVID and the technicians coming in there to actually solve it. My problem is that, and to be honest, I'm not opposing taking any vaccine. With all what is going on there, and in terms of a lot of conspiracy theory coming up with respect to the vaccine, a lot of people are scared. What has to happen, though, is a work in progress. And what has to happen is continued education. I am sure, by listening to you tonight, I've already feel convinced that I should have had 4 shots already, just the way you are educating people. But what is happening now? We have politicians contaminating the whole system. And I'll tell you why I say that. I believe in those who know to tell us. Not the politician. The politician and government, they are there with respect to policies. So yes, you put the protocols in place. We have to follow that. But when you have politicians actually coming to just give you figures, sometimes today they say something, it's a high figure, tomorrow it's low. You have people questioning, is it true? Is it really right? Should I take the vaccine? But see what is going on there tonight? That's education, free from politics, free from political interference. I'm feeling that Dominicans are going to take it. And those who are listening are even more convinced. So I want to congratulate you all for that education and continue to do so, because taking the vaccine is about giving people confidence that they can survive with the vaccine. And if some people are still reluctant, they can continue to feed on the information so that they can have a better judgment. But when you see politicians come and they contaminate the whole thing, we do not trust them. And for that is the reason why you have a low turnover with respect to vaccination. Thanks for the opportunity. Have a good night.
Yes, thank you, Colin. Thank
Thank
you
you,
for
Colin.
your contribution. What a wonderful contribution. And you are so right. It is about education. It is about being open to answering people's questions and not putting down people because they have questions and they have concerns. They have a right to have questions. They have a right to have
Yes.
concerns. And educators should be willing to answer the questions. I don't care if we have to answer the same questions 100 times. Okay, because people have questions, they have concerns, and educators like Dr. Yvette, who's doing a fantastic job here this evening, should be willing to answer those questions and answer those concerns, and even our nurses, because we see that a high population of nurses, some of them haven't taken the vaccine. So they too need to be educated. They too have questions. They too have concerns. And we have to have non-political figures, non-political people who are willing to step forward. And I'm so thankful that we've had Dr. Rolle, we've had Dr. Swinburne Augustine, Dr. Adrian, and everyone else, Dr. Gilda Nesty, Dr. Mignon Rolle, all the healthcare providers in Dominica who are stepping forth despite being so tired and so exhausted with this COVID-19 pandemic, but they're stepping forward and they're providing the information. And yes, they're answering the same questions over and over again. And if I can add one more thing, at least we were able to convince one person this
One is
evening to
good.
get the vaccine. So I think we've done our job for the evening. Any comments?
One is good. I just wanted to talk about the reason why some people may be hesitant in taking vaccines. And that is the same thing that's happening within the United States. And that is because of all these conspiracy theories that you find that on Twitter, on Facebook, on Instagram, all these different media platforms have their own thing going. And not only that, I was actually watching TV and a cardiologist, the man is a cardiologist. He's a doctor. He specializes in cardiologist. And he came on a religious program and he was saying that people should not be taking vaccines because of the side effect that it has on the heart. He's not an epidemiologist. He is not a public health care provider. He does not have the knowledge base to talk about COVID, not to talk about having a pandemic. He does not have the educational preparation, but he's giving his 2 cents. And so my students get in touch with me and they say, but Professor Roll, we're hearing all this stuff. I said, listen to me. You need to go to historical relevant sites. And when I say historical relevant sites, I'm talking about organizations that historically have researched health, like the CDC and the World Health Organization. These organizations have more authentic information. They have information based on science. They employ epidemiologists that know about pandemics. They employ healthcare workers that specialize in infectious diseases. These are the people we need to be reading about. We need to read things that they write. We need to look at the research that they have done. We don't need to be looking at other websites with people that we don't who have not been historical in their knowledge of managing COVID or managing pandemics. And so I think part of our education is to let people know they need to go to historically sound sites that have historically given us education related to healthcare. And these two sites, World Health Organization and the Centers for Disease Control.
Yes, thank you for that. Any comments, Roy?
Well, I would like to say that it was good to have been on a program. I hope that we did create some impression on the minds of the people who are against taking the vaccine. And I would like to, that's the first time I'm actually seeing you live. um, and I would like to congratulate you for such a show. And
Thank you.
like a friend of mine just said, the politics is out of it, and that is good. Maybe a number of people would not want to listen to a show on Q95 because of the politics. But I hope the many people who have heard us tonight would pass the message on to them that get the politics out. Let us do what is right to save our country. Because when the thing started up to, I think a week ago, we were telling the world we had no one dead because of COVID. And now I understood, subject to correction, that we have two. And God knows what could happen within the next 6 months, a year. And those people who have heard me tonight, ask yourself, if I was to catch COVID, do we have what it takes to survive? We are fortunate, like I say, only two, or maybe one. But the thing about it is, if it gets to the stage where it's an outbreak, how are we going to save the rest of the nation? And those people who want to play their politics and say that they will not take it because they're not saying it because of religious reasons, but they're saying it because of political reasons, because they're not happy about who brought it in and who didn't bring it in and which country it came from. Those people are saying that they have not walked, not a mile, but probably 10 feet in my shoe.
True.
Because if they do, they would be begging and begging to take the vaccines.
Yes, let's
Because
grab
I'm
a phone
telling you,
call. Let's
I
grab a phone
once
call, Roy.
referred to it as hell on earth. Thank you.
Yes, thank you, Roy. Let's take a phone call real quick.
Caller, go ahead, please, caller. Go ahead.
I want to say something. It's been months that I am pondering. Every time you hear people talk, they said we are going to stop COVID. But you scarcely hear people talk about with the help of God. We must always know that we cannot do nothing for ourselves without God. And we have to keep on saying from top to the bottom with the help of God. Because it's only God that will help us from there with using the other people to do the work. With the help of God, please.
Thanks a lot, caller.
Yes.
Thanks a lot.
Thank you.
Well, I
Yes,
don't know if
thank
she
you, caller.
wasn't
Very
listening.
true.
I don't, maybe she wasn't listening to the show. I did say, with the help of God, the nurses and the doctors, I helped survive. So maybe she didn't hear me, but we did bring that in at some time.
And I did say I was blessed, and I feel truly blessed to
Right.
have survived COVID.
Yes,
And
yes.
we
But
don't say
it's
it all the
always
time.
good to
Yeah,
include God.
yeah.
Absolutely.
Not only that, I got tested at church. That's where I had my testing at the Catholic Church. So God is, I know we have to remember God, but we also have to remember that God has also given us a mind and has also given us choice. Just keep that in mind
Absolutely.
in terms
Yes,
of our
absolutely.
faith.
And before we run out of time, I want us to talk about that all-important toolkits that I mentioned in the beginning, because I think sometimes we can have a black and white mentality, either or, and that is simply not necessary. Because I like to think of this as we're fighting a war and we're trying to engage all sorts of ammunition to combat this war. And I think it is so important that we don't think in terms of black and white, the vaccine or building our immune system. So if you, Dr. Rolle, if you had to include some items in that toolkit for the battle to eradicate COVID-19, what would you recommend?
Okay, this is what I would start with. And we talked about it somewhat. Be healthy. How do you acquire health? You acquire health through nutrition. How do we protect the body from infection? We need to have a robust immune system. That is an immune system that works, that is able to get rid of invading bacteria or invading viruses. nutrition and exercise. And you guys talked about exercise. I would just like to share with you, I'm a runner. And I think maybe that's one of the reasons why actually from the as soon I was able to get on, I was on the track. So I run, I practice yoga, and so exercise and activity is very important in keeping the respiratory system healthy and also the heart healthy. So if you do a lot of cardio and you're doing a lot of running, you're exercising your lungs and you're also exercising your heart. And so that's all good. And the muscles, you get the benefit of having muscles. And so that's good. So nutrition and exercise, get adequate sleep and stress. Sometimes we forget stress. I know as for in the United States, and even now when I think of how I got COVID, I was very stressed at the time when I was working. I was working under some very stressful conditions. Stress can also impact your immune system. So you need to be able to practice some type of practice, whether it's prayer. Prayer helps sometimes to keep you calm, so that you can de-stress and continue with your life. So these are very important. So now that we have eaten well and we have exercised, we have done our run, and we have controlled our stress, now we need to get vaccinated. Now, even though we're vaccinated, we still have to use our mask. We still have to practice social distancing, 6 feet apart. We still have to avoid shaking hands. And if we do have to shake hands, you need to use sanitizers to sanitize your hand, especially sanitize your hand. And sanitizing is even better because you don't want to have your hands touching somebody or some surface and touch your face. Guess what? Touching up the face, if you touch a surface area that has COVID viruses, you are most likely to also go ahead and transmit it by touch on your
Yes,
face.
and Dr. Rolle, if I can just jump in, we have a phone call, so let's just take the call.
Okay.
Thank you.
Caller, please go ahead.
Yeah, good night. How are you? Hello?
Go ahead with your call, sir.
Yeah, I think that's a wonderful program, but I'm listening to, I think it was Pierre Motley, who was saying to the Bajans that they should not allow the unvaccinated and the vaccinated feel like it's a war that they are fighting, and that should not be fair. I think we're going to see the same thing for one of us, that we should not allow those who are vaccinated and unvaccinated and let that be like a war that we're fighting. I think we should not allow that to define us as a people. I think Dominica, we are applicants, we are good people, we are sort of people I think we are learned, we can try to do the research ourselves, listen to the argument, and so on. And as a result, I think everybody should be left their own choice as far as taking the vaccine or not. But they should really not define us as to who take it and who will not take it, and then for us to be there like almost like enemies. Because to me, it's some communities, that's how it is. Somebody will take the vaccine and that person will get it, person will take it, someone will take it, and that person will. So I think we should not allow that to define us as a people.
Did you get a gist of what he said, Amlambi?
Yeah, he stressed that we should not allow the vaccinated and the non-vaccinated to be dividing each other, to be against each other.
Okay, thank you so much. Thank you for that comment. Dr. Rolle, you can continue.
Yeah. So as I was saying, I ended with not making sure that your hands, if you touch surfaces, that you make sure that you use a sanitizer, sanitize your hands before you touch your face, because that can also cause these organisms to go into your nostrils and your mouth, and you can get infected that way. Very, very important though, that if you are vaccinated and you do get a breakthrough infection, that you follow your healthcare provider instructions to self-isolate and also follow whatever instructions to treat the symptoms. That is very, very important that you do so. And while you are, if you do have a breakthrough infection, of course, you also need to wear masks within your homes so that you can protect the other residents of the home. And everyone needed to be tested if someone in the home becomes positive. I think that should be followed. So we put everything together. We put the nutrition, we put everything, we put the social distancing and the masking and the hand washing and the sanitizing. And if we do get sick, we need to go see a healthcare provider and follow the instructions of the healthcare provider. And with that said, although I didn't follow all of mine, I'm being honest about it. I'm kind of a nutcase myself sometimes. So I understand people who will resist not taking certain medications, but not the vaccine. The vaccine is so, so important to take. So with that said, do you have anything else to add to what
Yes,
we just said?
indeed. Yeah, I would certainly like to add, and I just want to say, if you're not on the Facebook Live, you would not have seen, but Lambi is in full swing with the protocols at the
Oh, okay.
studio, from the
Great.
mask to spraying down the equipment that he's using to the
Yeah,
sanitizer. So
very
we're
good.
happy to see that here at Q95, we practice what we preach. But I
All
think
right.
also, Doc, we also need to talk about the importance of supplements, herbs, and you mentioned ginger. Roy, did you want to chime in as we're adding to our toolkit on what else we can add to our toolkit in the battle to fight COVID-19?
I wanted to ask Roy
Well,
if he drank any ginger tea. Roy, did you drink any ginger?
well, yeah, I did drink my ginger tea. I did drink my
Okay.
kukuli
Mint,
tea.
mint.
I drank all those things, but
Okay.
um, it didn't appear to have been doing anything for me.
Oh.
But I was told to drink a lot of ginger tea. Maybe, who knows? Maybe the ginger tea helped me, but I don't know.
Did you
I don't
Mhm.
steam?
know. But I did drink a lot. I was told to drink a lot of ginger tea, and I did drink a lot of ginger tea at the time. And
Mhm.
I also drank watercress tea. I drank
Ooh,
all kind of tea.
you drank more
I
than
wanted,
me.
but I wanted to stay alive, man. I really
Okay.
Right.
wanted to stay alive.
Okay,
Mhm.
So
I have another
I, I,
question.
I
Did you
drink
do
all
any,
kind of.
did you steam? Did you
Did
inhale
you
the ginger
steam?
steam?
No,
The ginger
I did
steam.
that long after COVID. I got it in October, and was probably sometime in January, February. I was told to boil the water, put lime skin in it, and then inhale it, the steam.
Yes.
I was
Yeah.
told, but I thought it had to do something with my respiratory system.
Yes. Hmm.
That's what I was told. But they didn't specify that it had something to do with COVID. But if it means that I had to eat a house
You
to
would have
help
done
with
it.
my COVID, I would have done it.
Well, my husband believes that the ginger tea did all the difference. The ginger tea and the prayer, of course.
Yes, yes, and just with regards to the supplements, and I want to thank Mr. Carlton Lando over at Jolly's Pharmacy for providing me with this information. But here's what he recommended when I asked him about supplements that can
Okay.
help us to build our immune system. He mentioned vitamin D3. D as in David,
Yeah.
vitamin D3, vitamin B complex. Uh, he also recommended zinc,
Zinc.
selenium, and vitamin C as well. But of course, you always want to consult with your pharmacist, you want to consult with your doctor in terms of the dosage on anything that you're planning on taking. So again, Carlton at Jolly's Pharmacy, I want to thank you for providing us with that information. So I think we have a good sense of what should be in our toolkit against the fight of COVID-19. So we talked about the importance of the vaccine. We talked about the importance of eating well, getting sleep, reducing stress. We talked about the importance of exercise. I'm happy that you brought up running, Doc, because I'm a runner as well. So I know the benefits of
Yes.
staying strong And also we have to remember that running and exercises, they increase the strength of our organs.
Yes,
So
especially
when we
lungs and
hear
heart
about organ
muscles.
failure and we hear Roy talk about having to go to rehab for his lungs, and Roy is a strong
Right.
man, right?
Yeah, it
So
was,
for the average person, think of how much more important exercise is to maintaining a strong body in the unfortunate events that you contract COVID-19. So I think we have lots of great tools. We have the herbs and the supplements, and we have a phone call coming in.
Let's use everything we can.
Everything.
Please go ahead, caller. It's your turn. I think we lost him.
Okay, please feel free to call back. And of course, we want to take the Facebook Live comments before we wrap up this evening. And we want to thank everyone who joined us via Facebook. David Joseph says, education, education, education. For too long, the conspiracy theorists have been allowed to shout out from the top of the mountains all the theories and the global agenda of the Illuminati. So thank you, David, for that comment. Rosalind, this is an excellent program tonight. Thank you for the education. Thank you, Rosalind. Shona John, my former classmate, nice to see you on the live. Only one death related to COVID. So she's
One.
correcting you, Roy, that officially it's only one death related to COVID. So Shoma, thank you for that correction. Lorraine Del Sol also reiterates it's only one death. So thank you for that correction. David Joseph, my brother, I am in total agreement with everything that you're saying. However, I am saying that we should allow common sense to play the role in the decision that we make with our lives. So thank you for that. David, let's take some more comments before we wrap up the program. Lorraine agrees that she drinks ginger tea every night.
I
So we are all talking about how we are staying strong, how we're building our immunity, and how we are using all the tools in that toolkit. So how many of us can commit to using the toolkit tonight? I hope that the information that we're providing is valuable to you and you will commit to using everything that we have to fight COVID-19. So as we get ready to wind down the program, do you guys have any final comments you would like to share this evening?
well, I would just like to say again, Simone, that I really felt privileged. This is my very first time seeing you and very first time on your program.
Thank you.
And I really do feel privileged in having had the opportunity to share some of my experiences with you. I'm glad I got to see Roy. Roy, do I know you from somewhere?
Everybody knows Roy.
yeah, yeah. What you living at sometimes
In
somewhere
Pottersville, in Pottersville,
in
actually
Kennedy,
on Kennedy
not
Avenue. Yeah,
Kennedy Avenue?
yeah,
Huh?
Charles Brothers, Charles Brothers.
Right, right,
Yeah,
right. Yeah, I
Charles
remember. Yeah,
Brothers. Yeah, yeah,
I remember. I remembered you. I remembered you.
yeah, yeah, yeah.
Yeah, I
Well
remembered you.
represented
So
all.
I have never really listened to Q, but looks like I'll have to start listening to Q95. Um,
Thank you.
so thank you so much again for giving me this opportunity, and thanks to all the listeners. Thanks to all the people who called in. Thanks to all the people on Facebook who made this interactive and very interesting. And Simone, you are amazing. Roy,
Right, thank you.
you're one of a kind.
Thank you. Thank you. Thank you. Simon, I really want to congratulate you for that show. And I know tomorrow a number of people a number of people are going to ask you for a repeat because it was very educational. I didn't realize that you're going to bring a doctor. Neither did I know Yvette was a doctor. So it was nice to, to have been able to speak with the doctor. I'd like to take this opportunity to my friends, my family, my political leader, and everybody else in Dominica, and right now, not many people know I've left Miami and I'm presently living in Jamaica. I've taken up residence in Jamaica and I'm having a very good time. And I wish Dominica well. And I hope that what we have said tonight will at least resonate, will give people a better understanding of what this COVID thing is all about. And lastly, don't play games with COVID. It does not play games with anybody. It has no friends. You guys have a very good night.
Yes, thank you, Lambi. Do you have a call coming in?
Somebody was trying to call, but they quit. So let's continue.
Okay, we will wait to see if they will call us back. But I want to thank everyone who joined us on the Facebook Live. And of course, feel free to post your final comments. I see a couple of comments are coming in. But I also wanted to just quickly touch on Dr. Yvette. You mentioned it before, but home quarantines, because there's also a protocol in place. And I want to thank my very dear friend, Dr. Gilda Nesty Chang, for being the head of that division in Dominica. And she's already starting to put out great information about the importance of home quarantine. So just kind of quickly tell us about some of the protocols for home quarantine before we wrap up.
With home quarantine, you basically, and again, you have to have more than one room. If you don't have more than one room, it's going to be problematic, because the room is assigned to this person, and this person stays in that room, and all the care is provided in that particular room, and family members who interact with that person has to wear mask and also sanitize. My husband used to wear his mask, and when he came in he would sanitize his hands, and still practice social distancing, except when he had to help me to the restroom or something of that nature. And the person should not venture out from that little area. It's maddening, to be isolating yourself in just one particular area, and so that's how it is actually done, and advised to be done within the United States. That's what I was told that I should do, so that the rest of the people, I should not encourage visitors. So people shouldn't be coming to visit because they're coming to visit to get COVID. If they do visit, then they have to practice again hand sanitizing, wearing the mask, and socially distancing themselves, to interact with the person who is infected. So what is
Yeah, and just
happening?
go ahead.
What is happening in Dominica? Are they following the same protocol? What if someone has one
Well,
room? One room
exactly.
house, because I
And that
was
is
raised in a
exactly
one room house.
and that is exactly where I was going with the conversation, because one of the recommendations is that if you have COVID-19, you use a separate bathroom. Tell me how that's going to work. Most homes in Dominica has one bathroom. So here the recommendation is to sanitize after the
Sanitize.
person uses
Yeah.
the restroom, but the family, they're encouraged to wear masks. But I also hear about some stigma going on in Dominica if you test positive for COVID, that sometimes your family shuns you. You're told you cannot come home. So all those are important things to keep in mind in terms of protecting ourselves so we do not come down with COVID-19. And as we get ready to wrap up, let me take the last the Facebook Live, Lorraine Del Sol. Thank you, Dr. Rolle, for this information session. And I also want to thank you and Roy as well. I am sure you have convinced some anti-vaxxers to get the vaccine. Sherma John, great program. We'll tune in again. Thank you, Sherma. Sandra, oh yes, I've gotten some vitality in vitally, I think is what she was trying to say, important education. This has been such a wonderful program, 2 hours well spent. Thank you, Sandra. David Joseph, another excellent opportunity to educate and enlighten the masses. Even with different opinions, we can all agree that information disseminated here can and should be to the benefit of everyone. Good night, everyone. Very good. So thank you for that, Carl Kofi. Great exchange tonight. Just want to encourage people to make healthy choices in their lives moving forward. So thank you. Thank you, everyone. Oh, there's a phone call. I'm sorry. My head was down reading the comments. I'm sorry about that. We can't hear you.
Are you there?
Yeah, what happened?
There.
Oh,
What a wonderful program.
oh,
Thank you.
okay.
Very, very wonderful program. Very educational, very everything you can think about. I just want to thank everyone who took part, had even a little part to play in getting this program on the radio. Very, very, very good program. Thanks again to everyone. Love you all.
Thank you.
Thank you, caller. We love you too.
Love you too.
That's it, Lambi? Yes, thank you. So again, I want to
Thank
thank you.
you.
I want to thank you, Dr. Yvette Rolle and Mr. Roy Williams, for joining us on this very educational information. Thank you for sharing your very candid, Roy,
Oh, Roy.
information with us. You know, some of the
I
information
said
we
he's
could,
one of a kind. He's one of a kind.
some of the information we could have filed under too much information, but we want to
Simone,
thank you for
Rated,
your
rated.
Simone,
wonderful contribution to the program. And again, we just want to
Call me
reiterate.
anytime. Call me. I have a vast experience. Call
But
me
Yeah,
anytime.
thank
I think
you.
the listeners enjoyed it though.
Yes, they
Nobody
did. We
Yeah,
commented
can
on that
tell.
yeah, I
because
really
We can.
enjoyed it. I
what
really
you're
enjoyed
saying, what he's saying was real, even though he was graphic with it. But that's what happens when you got sick.
Absolutely, absolutely. And you know, we just want to encourage everyone to follow the advice of the experts because we know we're inundated with so much information. The health department in Dominica is doing a tremendous job. They're providing all the information that we need. They're staying on message. They haven't deviated from the message that they've been saying from day one. So if we don't listen to anyone else, I encourage us to
Let us
follow
live.
the advice of our own experts in Dominica and everything that they're telling us. And we want to thank Lambi. We want to thank Lambi and the console and Shoei Norris out there
Let's not
in
forget
Dominica.
Lambi. Let's not forget Lambi, man. This
Uh,
guy is good. This guy is good. Let's not forget him, man.
and Ron, you know, tomorrow night you're going to be on Sports Rap because of what you did tonight. So it's going to be
No,
big.
no
Oh,
problem. I'm always prepared to make some kind of contribution to my country. Not because I'm living in Jamaica to make it look like I fought in Dominica. No, I'll always love my Dominica. I'll love elsewhere, but I'll always love my Dominica.
yes, yes, and that is what this program is about. It's about tapping into the experts and the experiences of our Dominican brothers and sisters at home and at home and abroad to advance our lives in some way. And I truly hope that we've helped everyone with this very important decision. And the decision is really up to you whether you want to be vaccinated or not. But I hope that you took down some notes on the toolkit that we kept referring to and not make this a political issue, not make this a black and white issue, but think of it in terms of wanting to get the economy reopened in Dominica, wanting to get life back to normal, wanting to get rid of the anxiety that comes with not knowing, well, is the government going to shut down the country again? Is school going to be reopened? Think of if we had herd immunity and all of this was
yes.
behind us and we could go back to life as normal. Before you know it, Creole Festival season is right around the corner again. Carnival, Christmas is right around the corner again. And we just want to be able to put this behind us. So I hope that you will take advantage of one or all the items in the toolkit that we talked about so we can once and for all put COVID back in the rearview mirror and continue with our lives. So again, thank you. Thank you everyone who joined us on the Facebook Live. Remember to tune out the noise. Tune out the noise and focus on the information. And remember to give each and every one the right and the space to make their own decision without being guilty for whatever decision they've made. So again, I am Simone Mathieu, and you've been listening to Roots Connections on Q, and we will be back again in 2 weeks with another engaging program. So we look forward to you joining us, and we look forward to coming to you at this time. So again, thank you to Mr. G and the Q95 family, and we wish you a good evening. Dr. Roll, thank you.
Thank you.
Roy,
Bye.
Lanley, thank you. All right, have a good evening.
Okay.
Thank
You
you.
too. Bye bye.
Take care.